Helen, can you just introduce yourself and share a bit about your journey to becoming the CEO of Digital Health and Care Wales?
Yes, of course. Thank you, Imran. As you said, I'm Helen Thomas. I'm the Chief Exec of the National Digital Organisation for the NHS in Wales. I've been the Chief Exec for just over 3 years now. We're quite a young organisation, set up in 2021. Prior to being the Chief Exec here, I was the Interim Director of the predecessor organisation, but my background is in data and information.
So what are you most looking forward to at the BCS Faculty of Health and Care conference?
I think it's a great opportunity, and it's good to see that focus from the BCS on health and care. I think to having the opportunity to have a conversation, a broad conversation with colleagues about how we are taking forward professionalism of the digital health workforce, I think is that's the most exciting bit for me, is to have the conversations, to hear what others have been doing, to share the journey that we are on in Digital Health and Care Wales.
And that's amazing. And what do you think would be the biggest takeaway point for yourself and going forward from this conference onwards?
Well, I'm hopeful that I'm going to learn stuff, because we learn every day. Every day's a school day. So yeah, I'm hopeful that I will learn and get a better understanding of where others are in this journey as well. I think it is a bit of a collective endeavour, isn't it? You know, so yeah, really looking forward to understanding and hopefully pinching some ideas from others, because I'm going to share kind of where we are in Digital Health and Care Wales in my my bit of the conference.
So next question. In your opinion, what is the need of an organisation like the Faculty of Health and Care in today's healthcare landscape?
I think it's even more important that we have the support from a faculty like this, and it is very challenging at the moment in terms of the professional digital health landscape. It's also very exciting. It is, it's phenomenal, isn't it, in terms of the growth and the pace of change. But actually supporting individuals to really understand the opportunities that they've got, and how then you can support that empowerment of an individual to make choices about their own career. I mean, I'm professionals of all ages, to be honest, to actually understand the skills that are needed for the role they're fulfilling and how they can be the best they can be in that role, but also to understand the opportunities and the skills that and experience they would need to gain to actually step across or up into different roles. Really a transparency and a consistency that we don't have at the moment, I would say. So, even the simple kind of housekeeping stuff like standardization of job descriptions and role profiles, and understanding the competencies and the skills that underpin that, but also seeing the breadth of opportunity. There are so many roles now that hasn't been available to them before. So offering that kind of the support in terms of their learning and development journey, and the network actually of getting to know other people who are in the same profession, learning from others who have moved kind of into different elements, different disciplines, I think is a huge opportunity for that kind of learning and that development to grow for an individual.
And where do you think, when we compare the digital health and care in NHS comparing with the rest of the world, especially developed nations, where do you think we stand? How far along we are?
We're on the journey. I think we've got a way to go. I really do think we've got a way to go. I think there are tremendous opportunities to positively impact the delivery of health and care, the prevention, and the empowerment of patients to be in charge of their own health and well-being. I think that there is perhaps I think there's an understanding across digital health and care leadership that digital and data absolutely are kind of front and foremost to sustainability, improvement and transformation. I'm not quite sure we know how to achieve that. I'm not quite sure that we've got the levels of investment or the approach, or we've achieved the mindset cultural shift to actually looking at the transformation agenda through digital, and then ensuring that how we are going to move that agenda forward needs kind of more joined up strategic thinking, planning and investment. So I think, how do we compare? We're probably in the middle somewhere, I guess. But if you looked at some of the research around levels of investment in digital health when compared to other industries, we've got a way to go, I think, in terms of being able to realise an ambition that, you know, which we all believe, otherwise why would we be in this profession, that actually digital health is the main piece of the jigsaw here, you know, along with kind of long-term workforce planning and even actually infrastructure planning, but digital has got to be at the heart of that. So it's going to change the nature of the work.
Okay, and what do you think are the few, if you want to just mention one or two very briefly, some of the acute issues that needs to be addressed within the NHS when it comes to digital health and care?
Investment. It would be, you know, remiss of me not to, you know, but it's investment. There is enabling the we're still living with an inherent amount of legacy in the NHS. I mean, I'm speaking from my kind of experience of the Welsh NHS, but speaking to colleagues across the 4 nations, I know these are they are ubiquitous challenges that we're all facing. So investment, absolutely, but investment in a way that we de-risk where we are today, whilst investing in the changes that we need to see going forward. So really setting out kind of that the North Star, so that strategic direction that we're all aiming for, which is that fully integrated, joined up, you know, health and care kind of pathways that are underpinned and delivered through digital and data technologies. So there is, I think, just the investment and the strategic intent, and then the leadership and cultural development that's needed right across the board. But it's not just the digital and data professionals challenge, is it? This is about changing the way that we are delivering health and care services.
What are the current priorities for digital health in Wales, and how is digital health and care Wales addressing these?
Well, that's quite similar to the previous one, to be honest. So there's something about managing the the risks that we've got, so the legacy and dealing with the legacy, but see the have to describe the strategic direction. So we create that vision, that we all know where we're heading, but we also have that realistic kind of explanation, that roadmap to deliver it, because we're going to need to make some choices and priorities along the way there to do that. In the meantime, we're also trying to, in parallel with dealing with kind of what we've got to do today and where we want to head to tomorrow, actually laying the foundations. So a lot of the work that we're doing in my organisation is laying the foundations for change. So things like the NHS Wales app, that it is, you know, it's the tool that will, you know, becoming the front door, the digital front door to the NHS in Wales, that allow.
And lastly, what advice would you give to the aspiring leaders in the field of digital health?
I would say, well, first and foremost, enjoy it, because it is such an exciting place to work. You know, the space actually, rather than the place to work. And I'd also learn as much as you can. Take time to create relationships, and, you know, network with your colleagues and with your peers. Find yourself a mentor that will support your career journey. I think that's been really important to me in my own kind of career journey. Have that support network that you need. But yeah, just be curious, be a bit courageous, and believe in yourself.
That's amazing. Thanks so much. Thank you for your time. And that concludes our interview. Thank you so much for your time.
That's